Is the bone that supports the face and contributes to form the brain cavity. The skull is divided into two main parts: cranium, which is the fixed part of the skull, and the mobile part is called mandible. All bones of the skull are joined by immovable joints called suture, except the mandible bone, which joined by two mandibular left and right temporomandibular joint. The cranium, which is the fixed part, as we said, is also subdivided into two parts: neurocranium, which includes the bones of the brain, and the viscerocranium, which includes the facial bones. The first bone of the neurocranium is called occipital bone. It's the only bone developed by endochondral ossification, in contrast of all bone of the skull, which is developed by intramembranous ossification. The second bone of the neurocranium is called the two parietal bone, left and right parietal bone, which joined by what's called a sagittal suture. Also, there's a frontal bone, which joined to the two parietal bone by coronal suture. The facial bones are 14 in numbers: 2 single bones and 6 paired bones. The first single bone is vomer, and the second single bone is the mandible. The first pair of the facial bones is left and right zygomatic bone. The second is left and right maxilla bone. The third, left and right palatine bone. The fourth, left and right nasal bone. And left and right inferior nasal concha. The maxilla. We have left and right maxilla. It's a thin bone. It has an base and apex. And also it has 4 surfaces: the anterior surface, which contains infraorbital foramen; the posterior surface, we can see it by the lateral view of the skull; the superior surface, which is called orbital surface; and the medial surface, or the nasal surface of the maxilla. So it has 4 surfaces: the anterior surface, which contains the infraorbital foramen, and the posterior surface, we can see it by the lateral view, and the superior surface, which is called orbital surface, it's triangular in shape, and the medial surface or nasal surface. The maxilla also, it has 4 processes: alveolar process, palatine process, zygomatic process of the maxilla, and frontal process of the maxilla. The maxilla also, it contributes to form 3 cavities of the face. The first one, floor, roof of the mouth cavity, floor of the orbit cavity, and floor and nasal wall. On it contributes to form 2 cavities of the face. The first one, orbital cavity, and the second one is the zygomatic arch. Which the zygomatic bone, it contributes to form the orbital cavity, and also it contributes to form the zygomatic arch, which formed by joining of the zygomatic bone and temporal bone. It also contains 2 small foramen.
بعد ان الفيديو عجبكم اضغط لايك وشير سبسكرايب واستنونا في الحلقه الجايه. والله